Okay, guys, Timmy coming at you again. And today, what I want to talk to you about are these specialized hormones called incretins. And they're getting a lot of publicity recently with the big Ozempic deal, where Ozempic is now being used for weight loss as opposed to being the treatment for type 2 diabetes. So you're going to be seeing a lot of this in clinical. These drugs are newer, probably in the last 10, 12 years or so. And they've proven pretty effective in controlling type 2 diabetes. So let's get into it a little bit, all right? So first of all, one of the questions you should probably ask yourself is, how does your body know? Like, how does the alpha cells of the pancreas know to release insulin? Well, one of the ways that I showed you, like when we were talking about how a cell makes a protein, is that you actually have like glucoreceptors on your cell membrane, and they'll bind to the alpha cells of the pancreas and beta cells, and they will stimulate the release of insulin. Well, there's a couple of hormones that augment that release of insulin. And as a matter of fact, you actually get insulin released before you get this huge rise in your blood sugar. That's why your blood sugar doesn't get up really astronomically high. And it's in part due to the effects of these incretin hormones. So here you go. You eat something, num, 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 and you get some food in your belly, right? You get some food in your stomach, and that food is going to contain sugars, right? Carbs. And then it's going to contain fat, and it's going to contain protein, hopefully, right? So once you eat food and it gets into your stomach, then there are specialized cells within your stomach that sense that food in your stomach, and especially if there's a lot of carbs or glucose in your food, and these specialized cells in your stomach are going to cause the release of a hormone into your blood. And one of the big hormones that's released into your blood, one of the incretins, is called glucagon like peptide. Peptide means protein. Glucagon like peptide 1, and it's abbreviated GLP1. So again, you eat some food, you're going to get that food into your stomach. There are specialized cells that will sense that glucose load that you just ate and then release into the blood this hormone called GLP1. Now you got that in the blood. And one of its big functions is to stimulate the beta cells of the pancreas, and the beta cells are the cells of the pancreas that release insulin. So when GLP-1 binds to that specific receptor on the beta cells, it's going to cause the release of insulin into the blood. Then insulin's going to circulate to the cells of your body, bind to that insulin receptor, open up the glucose gate, and allow glucose to go from the blood into the cell, lowering your blood sugar. Now, that's its primary effect, but it has many other effects on the body. And again, wherever you have these GLP-1 receptors, that's where the hormone's going to take its effect. So if you look at this is some of the effects of GLP. So one of the things that it does, and one of the biggest things, and one of the reasons that it's used to lose weight, is that it decreases people's appetite. They've also found through studies that it provides some neural protection, meaning that it prevents brain damage, and it can actually impair or improve the recovery of some damaged nerves. So they're also thinking about using like Ozempic to treat people who have early signs of Alzheimer's or dementia. The other thing that it does is that it slows gastric emptying. And you learn this in general, and you'll learn it again in advance, that the longer food stays in your stomach, the longer you feel full. So this is how it reduces your appetite, and it also makes, when you do eat, it makes you feel fuller faster. So that helps reduce food intake. The big effects are on the liver. And one of the things that it does is that it decreases glucose production by your liver. Now, remember that any nutrient, glucose, fat, or protein, amino acids, in excess, the liver can convert that to glucose. So, and if you're a diabetic, the problem is too much glucose. So one of the big things that that GLP does is it decreases glucose production by the liver. So you don't take amino acids and make glucose out of it, and you don't take remnants of fat and make glucose out of it. So that's a good thing. It also increases glucose uptake by cells by increasing the cell's sensitivity to insulin, by putting more of those insulin receptors and making them more sensitive to insulin. That's going to reduce your blood sugar because cells are better able to take up that glucose. So it lowers your blood sugar. The other thing it does is it increases lipolysis, or the breakdown of fat from fat cells. And remember that you always use the fuel that's most readily available. So in this case, you're going to increase fat burning. That's another way that you lose weight. Also, it decreases inflammation. So Ozempic has been used in combination with people who have like arthritis or rheumatoid arthritis or inflammatory diseases, and it showed improvement. It also decreases insulin resistance, and it decreases insulin resistance by increasing the number and sensitivity of insulin receptors. And all of these things will reduce the amount of fat that you carry, and it will reduce your blood sugar. Now, it also has some effects on the pancreas, which I already explained in this slide, but there are some beneficial effects. One of the things that it does is that it inhibits the beta cell apoptosis, meaning that it slows down the death of these beta cells that secrete insulin. It also stimulates those cells to replicate. So not only do you reduce the death of these beta cells, but you also increase the production of these beta cells. So now you got more beta cells to release insulin. So you get that increased insulin release. And it decreases glucagon secretion. Now remember, insulin and glucagon are the opposite of each other. Insulin lowers your blood sugar. Glucagon raises your blood sugar. And how glucagon does that, if you remember, you store glucose in your liver primarily in the form of glycogen, which is glucose chemically bonded together. So by decreasing glucagon secretion, you're going to prevent the liver from releasing that glycogen into glucose and then dumping it into the blood. So that indirectly will lower your blood sugar. The other thing it does is it decreases fat in fat cells. So fat is removed from the fat cell. It becomes most readily available fuel to be used by the cells, and you will burn that fat, which is nice. Some other effects too is that it shows to have some cardiac protection as well. So a lot of people are using this to ward off, especially if you're diabetic, you're at dramatically increased risk for the development of heart disease. And as we go through the semester, I'll be explaining some of the complications of diabetes. So Ozempic, at least in its early cases, in its early use, is shown to have some really good effects. They don't know the long-term effects of Ozempic because it just hasn't been on the market long enough. But know this, there are always side effects to medications, and don't let anybody tell you different. So that's really how these work. So like Ozempic is a drug that is basically GLP-1. It mimics the effects of GLP-1. So the more GLP-1 you have, the more of all of these effects you're going to have. And Ozempic is a GLP-1 agonist, meaning it stimulates the GLP-1 receptors on the beta cells of the pancreas. So that's how these drugs work. And I also gave you a list, and there's Ozempic down there, and that's the injection that you take once a week. And then Rybelsus, that's the tablet that you take daily. And you probably heard of some of these, like Trulicity, right? Victoza, Ozempic, and Rybelsus. These are the ones that are used predominantly in the United States. Now, if we go back to this little drawing here, and again, my drawings aren't the best, but hopefully you'll get to the point. Now, there is an enzyme, and that enzyme is called dipeptidyl peptidase 4, and it belongs to a group of enzymes called gliptins. So if you see a drug, the generic name ending in gliptin, then you know that it's a dipeptidyl peptidase inhibitor. So let's go back at this. Now look, when GLP-1 binds to that receptor, as long as that GLP-1 stays bound to that GLP-1 receptor, it's going to cause the release of insulin. Now, do you want insulin being secreted all the time? Well, no, not really. You want it to be released when your blood sugar's high, right? So the other effect of these drugs is that it mimics how your body and your pancreas actually release insulin. Like if you haven't eaten in 4 or 5 hours, you don't have insulin circulating in your blood. Would make sense, right? So some of these older medicines like metformin that increase the release of insulin by the pancreas, they work around the clock. So they're always releasing insulin. You don't want that. You only want insulin release when your blood sugar is elevated, and your blood sugar is elevated typically a few hours after you eat. So that's why these drugs are seemingly better, because they mimic normal physiology, and that's what you want. So there's an enzyme floating around in your pancreas, and it's called DPP4. And its job, so I made it like a Pac-Man, is to take that GLP-1 that was bound to that receptor and eat it off the receptor, remove it from the receptor. Now, once it's removed from the receptor, the GLP-1, then there's no longer the release of insulin. Well, the problem in type 2 diabetes is sometimes the beta cells don't release enough insulin. So there's another class of drugs called DPP4 inhibitors. So basically what they do is they inhibit this enzyme. And if you inhibit the enzyme and GLP-1 binds there, it's going to stay on that receptor longer, and as a result, release more insulin. And it's also going to prevent the release of glucagon. So insulin, again, lowers your blood sugar, glucagon raises it. So those DPP4 inhibitors, you probably heard some of them. And these are the drugs. You probably heard of Januvia and Tradjenta. And then they've got newer ones that you got Januvia, and it's combined with metformin. And metformin is still used as a first-line drug in treating type 2 diabetes because, as I explained in the prior video, it does many of the things that are needed for a type 2 diabetic, like increasing cell sensitivity to insulin, reducing glucagon secretion, right? Reducing glucose uptake from the GI tract. And then you've got another a DPP4 inhibitor that's combined with simvastatin. And simvastatin, the statins are drugs that prevent the liver from releasing LDL cholesterol and dumping it into the blood. So this is in combination with this to lower your blood sugar, and then this lowers your cholesterol as well. So that's just a kind of a quick and dirty lesson on these newer drugs that are used to treat type 2 diabetes. So you should become familiar with their mechanism of action and the difference between the dipeptidase 4 inhibitors and the GLP-1 agonists. So these are medicines, the GLP-1 agonists, they actually stimulate that GLP-1 receptor. And the DPP4 inhibitors inhibit the enzyme that breaks down GLP-1 on that receptor. So if you inhibit that, then that GLP-1 is going to stay on that receptor longer and then produce its effects of dumping more insulin into the blood. And again, one of the big reasons that these drugs are in high demand right now is because they mimic normal physiology. And if you can take medication that mimics your normal physiology, the outcomes are typically better. All right, so I hope that helped.